Welcome to the Death Happens podcast, an insider's guide to dying. We're your insiders. I'm hospice nurse Penny.
And I'm Hallie, hospice social worker. Today with us, we have Dr. Faith Banks, who has been a veterinarian since the mid-90s, but more fascinating to us is she's a certified hospice and palliative care veterinarian. So I'm super excited to hear more about that. And she's in Canada, so we have a whole other litany of questions for her. But before that, I think Penny's got some education for us.
Yeah, so I thought it was timely and relevant to talk about pets as they relate to hospice. And there are a couple of topics regarding pets when it comes to hospice. The first is how people can sometimes be concerned about their pets, what will happen to their pets. So, for example, when we have patients who live alone or who have family that aren't really wanting to take on the responsibility of their little 10-year-old dog or their 5 cats,
Sure.
people who are dying often will worry very much about their pets. So I was thinking it would be good for us to kind of talk about the social work role when it comes to pet placement when a person
Sure.
is dying on hospice. And you are the expert for that, Hallie.
Well, I can certainly only speak about my hospice, but I am sure that social workers across the country have their own resources locally. So, our hospice is connected with a national organization called Pet Peace of Mind. And this organization helps people develop the worksheets for us to work with the pet owner and make sure we have the information on the pet, the vet information on the pet. So, if they've had shots or things like that, and then try to work out from our hospice into local communities to find out who might be able to adopt this pet. Part of Pet Peace of Mind also is to help keep the pet in the home with the patient until they're no longer with us, because we know, as experienced as we are, how important people's pets are to them.
Yeah, I love that so much. I don't know if my agency works with any specific organization. I do know that is a priority often when somebody's
Mm-hmm.
concerned about their pet. And there have actually been several of our clinicians who will take
Oh,
their
yeah.
pet.
Yeah, we've had
So,
that too. We've actually rehomed koi 3 times.
koi fish.
Yep, koi fish, not just cats and dogs.
And so are any of those koi in your pond, Hallie?
Yeah, they did end up in, some of them ended up in my pond, not all of them.
Wow, that's so interesting. People love their pets, and it doesn't matter if they're dogs, cats, birds, or fish, or snakes, or frogs, or lizards, or anything else. But now, speaking of clinicians and pets, here is where we have kind of a unpopular opinion. And unfortunately, it's not one, it's unpopular with us as well, but we understand the need for this. As most hospice agencies are now moving towards or already have a policy about pets being contained when the hospice staff comes to visit. We've had multiple animal bites of our clinicians.
Yeah.
Animals get very stressed out when their owner is sick, and when there are strangers coming in and out of the home, and even the nicest pets can turn on someone.
Yeah. Well, and especially,
Problematic.
I think when those pets, on top of being stressed in the strangers, especially the aides and the nurses, when you're right there in their space, in their physical space, touching their owner may wince or be having pain, and they
Mm-hmm.
don't know that it's not you causing it.
Well, and another thing too is that, as a nurse trying to do procedures that are supposed to be sterile, like putting in a Foley catheter, it's kind of hard to perform those procedures when you're, like having to brush the cat off the bed so that you can
Yeah.
do that. So it's really a problem in that way as well. And also problematic is the clinician who goes in and says, "No, the pet is fine. I love the little puppy. He's so cute. Bring him out. It's okay." And then we have other staff who go in there who are either wanting to follow the policy or afraid of dogs. And I
Or
know when
they're
I
allergic, for crying out loud.
or allergic, yes, or allergic, yeah. And so then you have, you've set up this little triangle here where you've got the patient saying, well, I won't say social worker, the chaplain said Fifi could be out during our visits. And that's really hard because we have to, ask our clinicians to respect their colleagues so that they're not setting them up for failure with the family.
Yeah,
So,
boundaries really are not only important for the clinicians not to get injured or not to be fearful of going into the home, but they're really a kindness to the pet and a
mhm,
kindness to the
mhm.
family to not be stressed out that their pet is causing a distraction or causing an injury or worried about their pet being stressed out. It's just easier. We're not in the home for that long. If you can just contain that animal in a different space from us, it's like I said, not very long, maybe an hour at the most.
Yeah, so when I worked at the care center, we had an aide who had been actually mauled by a dog in her
Oh,
youth
goodness.
and was terrified
Hmm.
of dogs, and we did allow pets at the care center. Most hospice care centers do, and that's where you have that's kind of like the other side of this, 'cause you can't
Yeah.
have them contain them when you go into the room, but you want their pets to be able to visit. It's such a sticky it's such a sticky situation. But we would have to, assign a different aide when there was a pet in the room because she was absolutely mortified of the animals. And, speaking of it being a sticky situation, so when we have somebody who's saying, "I've got a little dog and I'm really worried about it," and then we're thinking, okay, well, maybe a staff member might want that dog. They're not going to get the opportunity to get to know the animal. So
Yeah.
it's really it's a challenge. It's a challenge. I see both sides of it, honestly.
I could imagine if it was going to be someone adopting that maybe you finish your visit in a formal way and then
Mhm.
set aside a different time for just the pet interaction. Not
Yeah.
because it's a pre-approved, pre-arranged, not during the official hospice visit. If that was going to be an adoption situation, I could see that.
Yeah. Yeah. Yeah, I know. It's sticky and I get it why people want people to let their dogs and cats be out during the visit, but then also I work in quality and safety and I
Mhm.
have seen the injuries that our staff have sustained from animal bites, and
Yeah.
it's serious. It's
I've had a
serious.
dog come after me. Luckily, I had my big
Mm.
computer bag with me, and the owner came exactly at the right time. But it was a very large dog, and I'm not scared of dogs. And this, I wasn't
Wow.
quite sure if I was getting out of the house uninjured. So,
Wow. Yeah. Yeah, that is scary.
well, and another one last thing before we finish up our intro here is I'm thinking about pets and their owners. And one of the things I always recommend for families is, if possible, allow their pet to come and be with the owner that's died right after they die, because pets
Yes.
can smell. They deal with grief in a much more simple way and direct way. And if they don't get that opportunity, and sometimes it's not possible, maybe they're in a facility and they're just not able to, but if possible, bring that pet in. They're going to take like 30 seconds. It's not like us grieving, and they're going to continue to grieve in a different way.
Mhm.
But that initial being able to be with and smell their person is really going to make a difference in the pet's grieving. And then saving a blanket, saving a pillow with the owner's smell on it, especially if they're going to another family member's house, that's going to really help them as well.
Great point, and also takes me back to how challenging a situation it is to try to have people contain their pets because many pets want to be vigiling, you know,
Yes.
on the bed with the dying person.
Hmm.
Before we had our policy in place, I had a man who was dying, and his dog was a German Shepherd underneath the bed, underneath the hospital bed for a day, for 2 days,
Yeah.
would not leave.
Hmm.
So it's just such a tricky situation.
It is. It is.
Yeah.
Well, let's get to Faith. Super excited. Dr. Faith
Yes.
Banks.
Yay.
Dr. Faith Banks, thanks so much for being with us. We so
Welcome,
appreciate you
welcome.
spending the time.
Thank you. Thank you for having me.
When, as we know, you are a veterinarian, but we'd love to hear more about you. So tell us a little bit about yourself.
Sure. So, yes, I'm a vet. I live in Canada, in Toronto. And so I went to vet school almost 30 years ago and then sort of did what everybody mostly does after you graduate. I, was interested in small animal medicine. And so I started working at a clinic in Midtown Toronto. And I did that at several different clinics for about 16 years. And then 12 years ago, I started noticing changes in my older Bernese Mountain Dog.
Hmm.
She was slowing down. She wasn't sleeping well at night. She was panting and pacing all night long. She was having mobility issues. So losing muscle mass, having trouble getting up and walking around, having accidents in the house, all these sorts of things that just got me a little bit more interested in geriatric care and pain management. And so I sort of went down that road of trying to educate myself a little bit better on how I could care for her. And then I read an article about animal hospice, and I thought, oh my goodness, I've never heard of this before. I never knew there was such a thing. And it was pretty new back then, probably still. But I read this article and I thought, this is what I want to do. So I sent my husband a note, and I, was so excited about it. And so then I learned everything I could about animal hospice and decided to make the change. So I left regular practice and I opened up a mobile service in Toronto where I could go to people's homes and help them better understand and care for their own geriatric pets, and also help them pass at home. So perform in-home euthanasia. And so that's kind of how I got started. And so it's been about 12 years since I started that practice. And now I have several doctors working with me. And we have a team of hospice care coordinators that sort of speak to our families and just, give them the information they need and maybe set them up for an appointment. And so that was sort of what I started. And then 2 years ago, I should also say that I also started a service, which is aquamation, which is water-based cremation for
Right.
pets. So I have those two
Oh,
services that we offer families in and around Toronto.
And you mentioned that so casually. I'm guessing probably because it's been a little while since you've been doing this, but I imagine that was quite the shift going from a clinic practice that's very traditional to this mobile situation, which is fantastic. I'm sure parents of these pets love this.
Yes. Yes. Yes, it's been a while, so I guess I'm sort of used to it. I mean, when I tell people what I do, everyone's like, "Oh my God, you have the worst job in the world," especially when they
we
think,
can relate to that.
Yeah.
yeah,
To that
when they hear,
response.
right. I mean, when they hear euthanasia is a big part of our service, which
Yeah.
it is, they think it is the worst thing ever. And, so many times people open the door to let me into their house and it's the first thing out of their mouth. You have the worst job ever. But by
Oh.
the
Oh,
time I leave, they have such a different feeling.
mhm.
They're so grateful and thankful and happy and pleased with the service that we provide, and being able to be in their homes, as you know, is just it's completely different than having to do this in a veterinary clinic.
Hmm. Yeah,
Yes.
I can imagine the relief that the pets have too, that they aren't being transported in their, more vulnerable times or at the very end of their life, for sure.
Absolutely. Yeah. I mean, for some of the pets, it's very difficult. Mobility or immobility, I should say, in our
Hmm.
larger breed dogs, the giant breeds, we see dogs that are, 160 pounds, 130 pounds. I've euthanized a 223-pound dog
I
that
didn't
was
know they
Wow.
came
so
that big.
so big. Yeah, he was huge. And they couldn't move him. He didn't
Mm.
want to be moved, and therefore they couldn't move him. And so being able to be at home is so much less stress for the pets and for their families.
That's huge. Do
So,
do you just do small pets still, or do you do like more farm type pets, like horses or anything like that?
No, companion animals. I guess horses can be companions as well, but dogs, cats, and pocket pets.
Pocket pets.
oh,
Okay.
so
Bunnies,
like,
bunnies are
Yeah.
sort of the
oh,
typical ones that we see, but ferrets, or
Guinea
we see a lot
pigs.
of hamsters that come to our aquamation service for
Mm.
their families want their ashes returned to them, but we don't tend to euthanize a lot of hamsters because they tend to pass easily at home.
yeah,
Mm.
easily on their own. I know that
Yeah.
Hallie's got a list of questions, but
Yeah, jump in.
so yeah. So I'm thinking about when you go to somebody's home to euthanize their pet, and they have other animals. How do the other animals respond to you? Do you typically have them be in the same area with the pet, ask them to be removed, or how does that work when there are other animals that are part of the family?
Yeah, so I see that a lot. The strange thing that happens sometimes is I open the door and this really young looking bouncy golden retriever answers the door, and I know I'm there to help a golden retriever, and I think, oh no, but then I walk, a couple of steps and see their older one lying on the couch. But I do recommend other pets be present. I don't force it, but they want to be there. They want to be with their family. They want to be with the other pet. And I think it provides them with understanding and closure. If you took that older golden retriever out of the house and just never returned with him, the younger
Mhm.
one wouldn't know that we've taken them to the vet clinic for euthanasia. They
Yeah.
just they would probably keep looking around and wonder, where did they go, and be quite anxious and stressed about it. And so having them be present gives them that understanding. It also provides comfort for the families having them there. And so I always encourage it. I've never had to have a family remove a pet from the room because they were, too bothersome. And I usually just say to people, if your pet is not going to distract you from focusing on the one you're saying goodbye to, leave them. And very quickly, they calm down, they settle down. So it's comforting, I think, to have them there.
When you said that euthanasia is a big part, I imagine it probably is. What do the other what does palliative care for pets look like?
So we do telemedicine consultations now for families that are, I would say a lot of them are sort of struggling with decision making. So some of it is
Mm.
helping them to understand what quality of life looks like for a pet. So instead of saying what used to be said and maybe still gets said sometimes, go home and you'll know when it's time.
Mm.
I can't stand that. So I have a quality of life scale that goes through 14 different categories that will sort of help families understand what is important when you're a dog, what's important when you're a cat. This will help you kind of get into the mind of your pet and help you make an educated understanding of sort of where your pet is. So that's one thing that we do. And then the palliative care part is there are a lot of pets. I think, a friend of mine did a study, and she said about 50% of pets, dogs and cats, have not been to their veterinarian within their last year of life.
Mm.
So that means these pets are not receiving pain medication. These pets are not receiving any medication for the anxiety they feel for sundowning or, cognitive dysfunction, which is something we see a lot in older pets. These pets with kidney disease are not receiving any medication to help, with the toxins and the dehydration and all these things that we see, all the diseases that you would see in people in the later part of their life or the last part of their life. Pets are not receiving either, a lot of them. And so by speaking to families and understanding, either what the disease is, if we know, or what the symptoms or signs are that their pets are having, how can we help them? And so, there's a lot that we can do without going crazy and without, spending a fortune. But there's a lot that we can do to care for our pets towards the end of their life.
Is the scale that you use the scale?
I don't use that one. I know it very well, and I know Dr. Villalobos, who's the one who wrote that scale many years ago. But when I started this journey of learning about, geriatric care and pain management, it was one of our pieces of homework to make a quality of life scale. And so I
Mm.
put one together 12 years ago, and I've fine-tuned it along the way. I haven't changed it very much from what I did initially, and it was, based on that because that was the only one anyone had for pets.
Mhm.
And so it has some of those same things, happiness, mobility, hunger, that sort of thing. But one of the things I added several years ago was will to live. What is your pet's will to live? Because I sort of felt like that was the voice of the pet. And
Mm.
so, whereas the owner was kind of making all these assumptions and decisions about the pet, I sort of felt like this was their like voice. And so that was something that I added not that long ago.
So I learned about the scale because my daughter uh, got her master's in social work, and the what she did for her, I don't know what's it called, Hallie, when you have a
Practicum.
project practicum. She went to work at a veterinary clinic doing grief counseling, and so
Ah,
she is the one who told me about the scale, and I couldn't help but think, wow, why don't we have something like that for humans? Like.
there isn't a quality of life.
Mm-mm,
Interesting.
mm-mm. There's a
Not
palliative
in the same way.
performance. Yeah, there's a
Right,
palliative performance scale. That's different. That's what are they able to do,
right.
but the scale is really, there's more to, like you said, there's, yours has 14 different things. A
Yeah,
scale has a lot too. Um, but when she told me about that, I was like, huh, that is so weird that we have nothing like that for
yeah,
humans
that
to
is
be able
interesting.
to kind of evaluate their own quality of life.
Right.
So Hallie, I think
It
we might need to develop something like that.
Yeah.
there are a fair number of them out there in the veterinary world, because I think a lot of different people have sort of taken the scale and expanded on it. Some have done more of a checklist type of scale. Some have done, just lots and lots of sentences, and you sort of find the one that fits you best. There's all different ones that are available. I have mine on my website, so anybody can see it and use it. And I recommend people use it and then kind of put, if they scored decently, and then fold it up and put it away in your kitchen drawer, and either a couple of weeks later, or depending, if you sort of think, oh, I feel like he's dropped a little bit, or there's been a change, to pull it out and have a look at it again.
Well, I imagine with the invention of medicine, just like with humans, that we're able to extend our pet's life. And there really is a need for this palliative time in a pet's life, whereas before they really weren't. We weren't aware of it. We didn't have the information, and they weren't living as long, just like
Correct.
humans. And I imagine also with your quality of life scale that it really eases the burden of the decision making for the euthanasia.
Yes. It just takes all this stuff that you can't sort of put into words or a number, and it just kind of brings it all together and gives you this number to let you know how they're doing. And for so many families that I've spoken to, when we've gone through the scale and come up with a number, some of them are actually quite pleasantly surprised how well their pet is doing. And some of them, it really hits home that things are not good. And they really need to, they need to make a decision or do something a little bit more, I'd say, I don't know if drastic is the word, but something to really make a difference in the way the pet is feeling.
Maybe a
Let's
little more intentional.
Yeah.
Let's talk
Yeah.
about that decision part, because you did a really great video, and it was so timely because my daughter was having a very, very hard time, and she's the one who told me about the scale, but her cat was 19 years old, and she just kept saying, I feel like, well, for one thing, it was around Christmas time, and she had to schedule the mobile vet, and they were booked, and
Yeah.
so she didn't want to wait too long, and so she was just really wrestling with that idea of when's the right time. And you did a fantastic video talking about, like, sooner is better than later. So tell us a little bit about that.
Sure. So that video, I have over 400 videos that I've done, and they're all just me sitting and talking. They're short, but it's some stories of families that I've helped, and some of it is just my thoughts and opinions on what I've done and seen over the years in this space. And that video was the one that has had the most views for sure. And so the title of it is Better a Month Too Early Than a Day Too Late. And there are many variations. Better a week too early than a day too late, better a day too early than a day too late. Whatever it is, the idea is that you don't want to wait until things are really, really bad with your pet.
Mhm.
And, I've said this before, that in vet school, when we learned about euthanasia way back when, first of all, we didn't learn very much, but we learned that it was It was the kindest thing that you can do. It was a gift that you can do when a pet is suffering.
Mm-hmm.
And since I've started doing this, I've changed the way that I think about it in that we can prevent suffering. So
Hmm.
why do we have to wait until the pet is a heap of bones lying on the floor in their own feces, hasn't eaten for weeks, is crying all night long? Like I can go on and on. And these are things that happen to some of these pets when they don't have proper care. Um, and so why do we have to wait until that happens and then say, oh, now we should choose euthanasia? So, a classic example is the dog with osteosarcoma. They have bone cancer. It is extremely painful. They're 12 years old, 130 pounds. We know that bone is going to break
Hmm.
and it is going to be super painful. And so, why do we need to wait for that dog to break its bone? I'm not saying that the day you find out your dog has osteosarcoma to euthanize, because I don't think that's a good idea either. But I do think when you know the diagnosis and you know the path the pet is going to take, you know the trajectory of the disease, you know what is going to happen, why wait until things are so bad? Why not wait for, why not choose a day when there's sunshine and they're still eating liver treats and the whole family can come around, and all the people in the neighborhood have come to say goodbye, and you know and you just make it a beautiful special day. So that is sort of my whole thought process on doing it early versus later.
Penny, I feel your thoughts right now. I know what you're thinking. I just can tell. So, of course, Canada has a little bit different system, but in Washington State, we also have the death with
Mm,
dignity law, or medical aid in dying. And this
yes.
is so similar to so many conversations we've had and have heard. We've heard people say over and over, well, you wouldn't let a loved one suffer. If my animal's suffering, I euthanize them. Right.
Yeah.
And why would I let my parents suffer, right? When we're talking about people that aren't able to participate in MAID or death with dignity. But this
Yeah.
same conversation, you're always going to leave a little bit of life on the table to not
Yeah.
have the suffering at the
I
end.
love the way you just said that, Hallie. Leaving a
Yeah,
little
I
bit of
haven't
life on
heard
the
that. I
table.
like that too.
Whoop. Yeah, I like that. I also think there's a benefit to there. I mean, there's obviously the benefits that you've already talked about to having the animal euthanized in their own home. You don't have to transport them, but and hopefully, I know this is definitely not your practice, and hopefully no one you've ever known. But I was just telling Hallie that I used to be a vet tech, and I actually
Hmm.
worked for a couple of vets who were abusive to the animals.
Hmm.
And one of them, the practice that he had for euthanizing cats was to inject I forget what it
Euthanasia
is
drug.
that you use
We
into the
use
heart.
like pentobarbital.
Yeah,
Into
into
the
the
heart?
heart. Yeah, and they would have a massive heart attack and die. And I was
Oh,
just thought, God, if the owners knew that you were doing that, they wouldn't have brought their cat here. It was really horrible
hmm.
to see that happen.
So,
So
so intracardiac injection of pentobarbital is an acceptable route if the pet is anesthetized first or anesthetized. Americans don't like when I say anesthetized. Quite often people have written on my TikTok, why do you
why
say
are you
it like
pronouncing
that?
it like that?
So if they are given proper medication just prior to,
Mhm.
therefore they do not feel the injection, that is an acceptable route
Yeah,
if
he didn't do
they are
that.
anesthetized first.
Yeah, he didn't do
Hmm.
that.
Right.
Now, I think that might have been how Bun Bun, my bunny, was
Euthanized.
euthanized because he gave her some sedative first, and then he took her back. Well, I don't know, because when he brought her back to me, she was still living, but she didn't live for very long.
Hmm.
So I'm not sure exactly what he did, but I mean, I trusted the vet. So even though I had some bad experiences, but at this
Yeah.
particular vet, I really trusted him. And he went in the back, he gave her something, he brought her back out to me, and then I held her, and then she died in my hands. But yeah, the vet that did this to the cats was not he was not anesthetizing them first, unfortunately.
Right.
So,
Mm.
but I mean, like, if there is any trust issues that people have, and I hear that too, like people do worry, like when the vet takes their animal into the back, what are they
Yeah.
doing?
Right.
So being there in the home and doing it with them present is probably something else that really brings a lot of peace of mind.
For sure, for sure. I mean, everything we do, the families are right around us. So there's no, and I really don't think there's any need to take a pet to a back. I get why it was done before. And, listen, when I graduated, we we suggested to families not even to stay when we euthanized their
Mm.
pets.
Mm-hmm.
It was going to
Yeah.
be sad, and of course, and so we didn't really encourage them to be there, and so it's totally different now. Like I really, when people talk to me about how difficult they think it's going to be for them to be present, I mean, of course it will be, but I really encourage them to think hard about not being there at the end. Put their pet first, not think about how much you're going to cry and how you'll feel, but just be there for your pet.
I have told this to a lot of people about grief in general, and it seems to fit perfectly with pet loss as well. Is that the more you're able to just express that grief in the moment acutely, that the less difficulty you're going to have down the road. It's still going to be hard and there's going to be waves, but if you're able to just let it out, like so many other cultures around the world where they can just be open about their grieving, I think that has transitioned too, with veterinary care, is that if you're not there when it happens, you're not seeing it, you're not able to kind of wrap your brain around it.
Mm-hmm.
Whereas if you're at home or even at the vet's office and you're there to witness it, you know that it was peaceful. And so that
Yes.
part of it is not a mystery.
Mm-hmm.
And it's I think a great transition into part of your bio talks about pet loss and grief. And so I'd love to ask you more about that and what your service does and what that looks like.
Sure. What does that look like? Well, we have people answering the phones. I think that's the first thing. My
Mm.
team of hospice care coordinators are a bunch of incredible women who aren't looking at a clock, for the amount of time they're talking. They're not trying to sell anything. They're there to answer the questions and have an ear for the
Mm.
family that is calling. And I know that just picking up the phone to dial our number is so hard for families because it's the first step quite often. So we have very compassionate, caring people that are answering the phone or communicating with the family. So I think that's the first step, and so they feel confident in being in our capable and compassionate hands. So I think that's the first part of it. Our doctors as well are very caring. I mean, I have to say that it's a special type of person that is drawn to this type of work,
Mm-hmm.
as you know. It's not for everybody. I speak to a lot of veterinarians that say, no, thank you. I would never do that. Not interested. When they see that they have a euthanasia in the calendar coming into the clinic that day, and I used to be like this too. It was like, oh my God, that was very stressful.
Mm-hmm.
But we look at it so differently that we can just provide such a beautiful, wonderful service for families, and we know what a difference it makes. So I think the pet loss and the owner grief part of it is just the people that they're dealing with in my service are really, I'm tooting my horn, but they're a fantastic group of people, and we're caring, and we're all pet owners, and we've all been through loss, and so we really understand the connection and the bond that people have with their pets,
Mm-hmm.
and know that for so many, their pets are all they have. I mean,
Mm-hmm.
you work at home and your cat is sitting on your lap or sitting on the chair right beside you. You go for a walk and get your exercise, your dog is with you. You're social out when you're going to the park, it's because your dog is there. And, there's such a huge part of our life, and we get that. So I think that's a big part of it. My team has done training on pet loss. to better understand sort of the emotions that people feel and how we can help. But we're not there to fix their problems. We're not there to take away their pain. We're there to listen and, to walk by them, but not to fix. And so, I think that's also part of sort of how we think about things, and just be there for after. We follow up with an email to families, we follow up with a sympathy card, we make a donation to the family. So we have a lot of things that we do specifically to show that we get the significance of the
Mm.
loss.
Which really is so important, because pet loss in particular is one of those very disenfranchised griefs. We
Yes.
know this commonly. There's a lot of them.
Yes.
Sibling loss is another one.
Mhm.
But pet loss for sure. I happen to help our bereavement department with specifically pet loss when we get community referrals for pet loss. And so it's great to hear that there's more out there, more resources. I've been seeing more and more support groups and information and training on being able to support people, because like you said, sometimes it's their only family, it's their only support.
Yeah. Yeah.
Yeah.
It's a huge loss. And, before I started this program, this service, as I said, I had been in practice for 16 years. And I mean, I understood pet loss, but I didn't really, really, really get it until I did a course that really hammered it home for me. And
Mm.
it just totally changed how I thought about it after that. And it made such a difference.
When thinking about vet clinics, you were mentioning vets that see that on the calendar, right? And we all three of us live in this world of end of life and dying and normalizing it, and that's why we're here. That's why we're doing this. But you wouldn't it makes sense. Like in an emergency situation, you're going to have births and deaths and everything. But in a normal clinic, having emotionally for yourself to go through bringing in puppies for their first shot, and your next visit is euthanasia, and then your next visit is annual shots for a dog or whatever, and having to switch back and forth. I know when I interviewed my own vet, we had this conversation about, you're not really trained in how to
Right.
deal with people. You're not doing social work in vet
Yeah.
school. You're doing
Right.
medicine in vet school. And so you're also not only having to deal with your own emotions, but the poor people that you're dealing with. And so in this world where you are, you're prepared for that. You're
Yes.
It's a different focus, like you said. You're thinking about it in a different way, and I love that.
For sure. I mean, listen, I also do realize that the families that we help in our service, I'm meeting for the first time. I'm showing up at their door, and I've never met them before. I don't have a relationship with them. When you're in regular practice, you may have had a relationship with that cat and owner for 20 years,
Yeah.
and you fixed that cat when they got hit by a car, you fixed their leg, and treated them for pancreatitis, and you did this and you did that, and you saw the owner's children grow up, and like, you have a relationship with them. And so when
Hmm.
it comes time to say goodbye, it is a very, very emotional time for sure. And I
Hmm.
do understand that you know, my appointments are very emotional for the families, but I don't have that same sort of long-term connection that regular vets have had. And as you just said, to go from that into a new exam where you have to try and win over this new puppy's owner to, that you're so wonderful, and you're just mush inside. I mean, that is
Hmm.
really, really challenging for veterinarians for sure.
Yeah, as you were talking about the difference between taking care of the animal for 20 years and being the one to go in to euthanize them who hasn't taken care of them. I don't know, Hallie, if you were thinking the same thing as me. Yep. But same hospice, like people are always saying, it's so sad. It must be so sad. Are you so
Mhm.
sad? Like, no, this isn't my family. Um,
Yes.
I knew when this person came on to service that they were dying. That's the expected outcome,
Yeah.
Right.
and so if the death goes well, then it's a job well done when they die. And so I really can relate to that idea of, that separation and the ability to be able to do that work, because you're not clouded with the grief of losing somebody that's important to you, because, you haven't been a part of their life forever.
Yeah, for sure. I just, so I have 3 Bernese Mountain Dogs, and I just helped a family say goodbye to their 6-year-old Bernese Mountain
Oh,
Dog. It
Oh,
was heartbreaking. This dog was gorgeous. I just talked about him on a video, and the family was beyond devastated. And so she said to me, "Is it harder for you when it's a Bernese Mountain Dog?" Which was interesting. And, the second part of it was, "How do you do this?" And I said, he's not my dog. And so, I can separate. But of course, when I see it is a Bernese Mountain Dog, there's just a little bit more of a, connection, I
oh,
think.
and I'm
But
6 years old.
yeah.
You know,
6 years old.
yeah, I
Yeah,
think it's the same for us when we have a 20-year-old patient dying of cancer versus a 80-year-old patient dying of cancer.
right,
It's a little
right.
bit more of a, oof,
Yes.
that
Mhm.
hurts.
Definitely. Definitely. But as you said, like I tell people this is not my dog. I appreciate the how sad the situation is, but I'm here to make it beautiful and perfect for you. And so that's kind of where my focus is. I'm not absorbing the emotions from it all. I mean, my eyes well up all the time, but I want to make sure that it's as perfect as I can make it.
I love that you are on social media talking about this. So probably right around the time that you became a hospice vet, I was a hospice nurse and had been for a long time, and my cat he had thyroid condition,
Hmm.
and he was 10 years old, and my daughters were like, "You have to treat him. We don't want him to die." I was like, "Okay." The pills were $1 a day, so $30 a month. Back then, didn't have a lot of money, so I was like, "Oh, it's gonna be $30 a month." And they were like, "We'll pay for it." I said, "Okay, I'll do it. I'll do it. We'll do this medication." Well, one of the side effects, I'm sure you know, is it can cause liver failure, and so he actually did start having liver failure, and we had
Mm.
to stop the medication. And so at that time, I said, "Okay, Ross is on hospice now." And I'd never heard of animal hospice. It just didn't exist at that time.
Yeah.
And basically what that meant was Ross just spent his days sleeping on a rug in front of the dryer, and he ate whatever he wanted, and we
Right.
just, loved on him. And then when the time came and it was evident my dad had recently died, my son was visiting from Japan where he lived, and it had been his cat when he was a teenager. And so it was kind of like there was just something about looking at him one day and knowing it was time, and taking him in. There were no mobile vets back then, and
Right.
taking him in and having him euthanized. But so then when I started to hear about pet hospice, I was like, dang, that's awesome. I actually thought of that on my own too. I'm a pioneer.
Yeah.
But
I
I love that you're talking about it on social media so people can be aware of it.
Mhm.
I think that it's a shift in, to me, it's just a shift in the way that I think about caring for a pet. It's shifting from let's do
Mhm.
blood work again, let's take more X-rays,
Mhm.
shifting from that to just caring, from curing to caring, and
Mhm.
and so that's sort of the big shift. In the way that I think about how we care for those pets. And, I had somebody not that long ago who had a cat with kidney disease, and she read everything there was to read about kidney disease, and she was doing everything she could. And it got to a point where her cat would run every time she would see the owner get up because she
Oh.
thought she was going to be, pilled, that she was going to be stuck with the needle for fluids. And it got to a point where the owner felt like, she had no connection with the cat anymore. And it was heartbreaking for her. And so she made the decision to stop treatment. And, it was really hard for her, but I supported her and I understood it. And she got to enjoy the last while with her cat and have that connection and that bond again, and that was
Mm.
so important. So it's a change in how we think about things. And the social media part for me, Dr. Sammy Winemaker,
I love
who is
Dr.
on social
Sammy.
media. So
Yeah.
we went to high school together.
Oh
We're friends.
my
He's
gosh.
my age. We were in high school together. And I started following her, and I really just loved it. And we connected again, and she sort of encouraged me to do it. And I thought, okay. So I, sat here and started. And I really enjoy thinking of topics to talk about. And I love the responses of people saying, I've been following you for the last few months and you helped prepare me so much
Mm.
for the end with my cat. And it was so much better for me and less stressful. And I get it. And I understood it. And, when this happened during the euthanasia, I was prepared. And, to me, it's the being prepared and having a plan and understanding makes a huge, huge difference for people. And
Yeah.
I love that part of it.
Well, I want to give a little bit of time for the aquamation part because that's
Oh.
even new for people. And
Yeah.
so
Yeah.
could you speak a little bit about, I know what it is, but for the listeners, can you speak a little bit about that?
Sure. So aquamation is water-based cremation. And so the way that I describe it is that, and I start from a place of neither of these are really pleasant to think about. So with flame cremation or fire or regular cremation, you use fire to reduce the body to bone. So at the end of the process, you have bones. With water cremation, it's the same. It's a special machine that uses water and alkali salt, time and temperature. And at the end, which is for us 17 hours for our pets, 17 hours later, when we open the machine, we have bones. In both situations, the next step is to process the bones. So we have to dry our bones first, which they're individually sort of per pet placed on a drying rack. And then those bones are processed or ground using a special machine called a cremulator. And at the end, you have sort of a powdery substance, which are bones. And so that's what ashes are. Ashes are processed bones. And so we provide that for the families that we service through our vet service, and also some other, people can find us and use us. You don't have to come through our vet service. Pets that have passed at home or at another clinic and they want to use our service, they certainly can. It's a more eco-friendly type of care. And for us, it means that the pet stays in our care throughout their end of life. So if we have euthanized their pet, my team cares for them the whole way. So there isn't sort of another company that is picking up their bodies and processing them. And so people really like that part of it as well. So I have a team of 3 women that work at my aquamation center and care for these pets beautifully. I say we call them by their name. They're not a number. And it's just really sort of caring, specialized aftercare. We do memorial items, nose ink prints and paw prints and little resin, paw prints with fur in them. And, we have all these different things that people can or cannot. They certainly don't have to, but they have different options of different memorial items if they're important. And for people who want to have their pets' ashes returned to them, which in our service is about 70% of the families, they are able to do what we call private aquamation. And so they're able to have their pets' ashes returned to them.
Love that. If down the road you want a different green option, be sure to talk to Kate Spade at Recompose.
Katrina.
Yes, sorry.
I've seen that.
Yeah.
Yes, I've seen that.
Yeah. We actually interviewed her yesterday about
very cool.
human body composting. Yeah.
Right.
Yeah, that's exactly what I was thinking too. Like,
it would just take a lot longer, but it's funny. You both are these innovative, smart women CEOs with women groups. I love it.
Yes. Yeah. And being environmentally friendly.
Yes.
Right.
Eco-conscious. I love it. That's great.
Right. You need a lot of space for that, I believe.
It is a little more space. Yeah. And it takes longer.
It does take, it takes for humans, 3 to 4. But Katrina was telling us that farmers have been doing livestock composting, and that's where she actually got the idea for doing it for humans. Was she had heard about how they do it for
interesting. Yes, I have seen that. Interesting.
Well, we're getting low on our time with you, and I want to make sure I offer anything else that you want to tell us about this that we haven't asked you or covered, or Normally we ask like, what's a great experience or a unusual request or something like that. But, it's up to you. The floor is yours.
Well, I mean, we have had people that, not many, but we've had the request to remove a tail from a
Oh,
cat. We've had a request to remove an ear from a dog. We have someone who started working with us that he is doing aftercare for some pets that the families find him, and so he will remove the skin or pelt or fur, however you want to call it,
to
so
do
they can
like taxidermy for these things?
well, that one's not doing taxidermy. They're just keeping the fur, like a little
Oh,
rug kind of thing, from the cat. We have pets. We've had a couple in our service where the families have done freeze drying.
I have seen videos of that. That is fascinating. I'm
Yes.
not
Of their
sure I
animal?
would like it, but
They freeze
Right.
dry the
So,
animal?
yes. So it's similar in looking like taxidermy in
Mhm.
that, it looks like your pet, whereas taxidermy, the skin is placed over a form, so like
Mhm.
a shape. Whereas freeze drying is more like it's all your pet. And so they sort of curl them up in a little snugly position, and you can place them on the bed. It takes a couple of months for the process, but we've had a few people that have had that done. Certainly, some people want to have their pets' skeletons returned to them, and so use Dermestid beetles for that. So there are all sorts of things, and I sort of started saying different, not weird.
Yeah.
I like that.
Okay. And we're all pet owners. I want to know if you guys would ever consider, like Bernese mountain dogs are huge. You could have a nice rug in front of your hearth. Would that ever cross your mind to,
No,
yeah,
no.
same. I just feel like, I mean, and I love my cat's fur. She's a little brown tabby and she's got beautiful markings and everything. It just, to me, it's too different.
We
Too
do
different.
at our at the euthanasia appointments that we do for families. We do 2 memorial items for them that are included in our service. So we bring some clay and we do a little paw print impression for them, if they want. And then we also shave a little bit of fur from their pet, and we have a little container that we put it in. So many people like that.
Mhm.
Certainly going, for the whole thing is next level, but
To each their own.
everyone's different.
Yeah, to each
To each
their
their
Yeah,
own.
own.
yeah.
Yeah. Yeah.
Well, my little cattle dog puppy shed so much hair, I can't even imagine wanting to keep more of it after he dies someday. I'll just be
It's
glad to be
already
done with
all
the
over your
hair.
house.
It's
Yeah.
everywhere.
Most people with short-haired dogs don't want the fur, and they make the same joke, which is they'll be finding the fur for months to come.
Yeah.
I,
Yeah.
I know it's coming before, but I ask anyways. It's usually cats and longer haired dogs that want the little sample of fur, and each color represented.
Oh, yeah.
Hmm.
Well, we've talked a little bit about the fact that you make videos. Let the people know where they can find you.
So you can find me on TikTok at dr.faithbanks. Our website is www.mmvhs.ca, and that's where the quality of life scale is, where that we spoke about. So I think that's a really helpful thing for listeners. Hospice Vet is our handle for Instagram.
Okay. Well, Dr. Faith, thank you so much for being here. It was just like talking to another hospice clinician. We love it.
Yeah. Yeah. I'm
And
so
getting this
happy you came on.
information. I really hope that hospice veterinary work spreads and gets bigger and more acceptable / known. I think a
And
lot of people don't even know
available.
about it.
And
And available.
Thank you.
Yeah.
There's a large group of us, not so many in Canada, definitely in the US. There are a fair number. And every year we have a conference for all of us, the International Association for Animal Hospice and Palliative Care, all
Awesome.
like-minded people. It's, I'm sure you feel it when you meet other hospice nurses and you feel like these are my people. And so it's pretty amazing to get together and talk about all of this and learn from each other as well.
I love it. Well, thank you so,
Thank
so
you so
much.
much.
Thank you. Thank you.
Another great
Wow.
guest in the books.
Another one.
Yeah.
I keep thinking like someday we're going to have just a normal guest, but I don't think there's such a thing.
Actually, it's another great guest in the can, I guess they say in the biz, right? Show business.
Well,
I
it
was
really was
so
just like talking to another hospice clinician. I mean, so much of it's parallel.
it is. It really is. Yeah, just it really was. So much of what she said just resonated for me and for you, I know, as hospice clinicians for humans and human death.
For
Fascinating.
sure. Hmm.
Fascinating.
Well, after this, we have Katrina coming up next, and then we'll have our end of the season wrap up. Can you believe season one's already done almost?
So fast. It just flew right by.
All right. Until next time, remember to live.
Because someday you'll all be dead. We'll all be dead. So not just you, but all of
Yes.
us will be
All
dead.
of us.